Thanks, Sylvia, for starting the session. Welcome back, everybody. After what was a very rich panel, we've got a series of exciting presentations lined up for you. Top experts in their respective regions who will showcase what they have been doing in terms of food environment research in the last few years, past and ongoing projects. And I'm very much looking forward to hearing from their experience and expertise. I think the first presenter, Tamrin, is not online. She has a pre-recorded session. Okay, so we can go ahead with the recording.
Hi, my name is Tamrin Frank from the University of the Western Cape in South Africa, and I am presenting some research on food industry expenditure on television marketing in sub-Saharan Africa. As we all know, there is an excessive consumption of unhealthy foods high in sugar, salt, and saturated fat that we are seeing a proliferation of, particularly in sub-Saharan Africa, and that is leading to increased levels of obesity and non-communicable diseases. This is largely driven by the for-profit ultra-processed food and beverage industry, who make use of various marketing techniques such as television marketing in order to promote and sell their sales to drive up consumption, which of course in turn leads to increased profits for their companies. And TV marketing is one of the most influential forms of marketing that they use. We have unfortunately seen very, very rapid increases and expected ongoing increases in obesity in sub-Saharan Africa. In the 9 countries in this study, we see that there's an expected increase year on year in both adult and childhood obesity levels in all the countries, which is quite alarming, particularly when we think about the non-communicable diseases that these obesity rates are linked to. And these estimations are based on the World Obesity Federation estimations. So the study objective of this study was to look at the extent of television marketing of food and beverage companies in sub-Saharan Africa. We made use of secondary data that we've obtained from an advertising broadcast monitoring company that records and examines all adverts that are both on free and paid television stations across Africa. Currently, we've included 9 countries, sub-Saharan Africa countries, being Angola, Ethiopia, Ghana, Kenya, Namibia, Nigeria, Tanzania, Zambia, and Zimbabwe. We will also be adding a 10th country, South Africa, to our final results. And we've made use of data over a 4-year period from 2019 up until and including 2022. Please note that the results I'm sharing with you are very much a work in progress. These are preliminary results. And so, of course, we will welcome any feedback in terms of improvements as we go along. The stations that have been included in this include all free television stations as well as paid for television stations that are covered under MultiChoice. MultiChoice is the largest paid broadcaster in Africa, and then the other one is Canal Plus. We have not included Canal Plus, but fortunately it is the smaller broadcaster in most of the countries that we have included in the study. Going on to the results, if we look at the spend on marketing, and this is in US million dollars, over the 4-year period, so we've included all 4 years together. The first dark bar is the total, the blue bar is non-alcoholic beverages, the red bar is food, and the light grey bar is alcoholic beverages. What we see is that Kenya is the largest spend on television marketing at over 180 million US dollars over the 4-year period, followed by Ghana and Zambia, and then Tanzania, Namibia, and Zimbabwe are the smallest spend on television marketing. In total, across all of the countries, over the 4-year period, more than 350 million US dollars has been spent on television marketing by the food and beverage industry. And this only includes what they're paying for their adverts to be aired. This does not take into account how much it takes to develop and produce the adverts, which we know is quite expensive. It doesn't take into account any other form of marketing. This is only the money that is being spent for the airing of TV adverts. And so I think, this is quite alarming if we think about just what the socioeconomic situation looks like in all of these countries and how far $350 million could go in other areas. The overall advertisers that were spending the largest amount and having the most number of adverts for non-alcoholic beverages were Trade King Group, followed by Coca-Cola and Nestle. For food items, it was also Trade King Groups, followed by Unilever and Dufil. For alcoholic beverages, it was Diageo, followed by Don Copitas, and then AB InBev. We did look at each country individually. Unfortunately, I don't have a lot of time to go through this, but just the first on the left-hand side shows you the brand that was most frequently advertised, and then the bar that is the highest shows the brand that had the highest spend in dollars. So in Angola, Tiagra was most frequently advertised, and Amstel was spending the most money on their adverts. Of course, depending on what time of day and what television show the advert is placed in, the spend on advertising differs from show to show. In Ethiopia, it was Pepsi for both. In Ghana, it was Milo for both. In Kenya, Coca-Cola for both. The same for Namibia with Coca-Cola. In Nigeria, it was Milo. In Tanzania, it was Serengeti beer, which is an alcoholic beverage. And then in Zambia, we see Dairy Gold being most frequently advertised, but Vatra spending the most on their marketing on television. In Zimbabwe, it was Coca-Cola for both. And this slide just shows which TV program in each country one found the most amount of food and beverage advertisements during the break times in. So that, of course, differs from country to country. The study does have some limitations. We, in terms of paid television, did not include the Canal Plus television programs. We've made use of secondary data, which, as we all know, has some limitations of its own, and we haven't assessed the content of each individual advert. We are busy with a study on this in South Africa, and if there are any people interested from any of the countries that we mentioned in a more in-depth analysis within your country of the data, please do reach out to us. We certainly would be interested in collaborating on further analysis of this data. In conclusion, I think we can say that TV marketing of unhealthy foods and beverages and alcoholic beverages is prolific in sub-Saharan Africa, and that the food and beverage industry is spending a large amount of money marketing their products, and that we urgently need policies that will protect the population against the pervasive marketing of the for-profit food industry. And yeah, better marketing regulations in all of these countries are certainly ideal. Of course, the study wouldn't have been possible without the support of my co-authors on the study, Lisa Dice, Alice Khan, and Rena Swart, and funding from Bloomberg Philanthropies. Thank you so much for your time, and please feel free to reach out should you have any questions. Thanks.
Okay, thank you so much, Tamrin. In your absence, I believe some of your colleagues are online and will attend to some questions, which we will have at the end. So there's going to be Q&A at the end. So in the interest of time, I suggest that we proceed with the second presentation by Rebecca Pradey, who's going to be talking about the TAMI project. Rebecca, over to you.
Thank you. Hi, everyone. Hi, everyone. Thank you very much for inviting me to present my fellowship project, which is entitled TAMI, Tackling Multiple Forms of Malnutrition in Ethiopia Amongst Women of Reproductive Age and Children Under 5. Next slide, please. So this project is part of a global fellowship that I was awarded by the European Commission for 3 years, starting in January 2023. And as part of this fellowship, I'm hosted by 3 institutions: the French National Research Institute for Sustainable Development, IRD, the French Agricultural Research Organization, CIRAD, as well as the UNESCO Chair World Food System, and finally the International Food Policy Research Institute in Washington, and I'm currently based in Washington for 1 year. You can see the name of my mentors and collaborators. And in Ethiopia, I'm working closely with Addis Ababa University, the Ethiopian Public Health Institute, Addis Continental Institute of Public Health, and also some colleagues at IFPRI, Addis Ababa. Next, please. So let me now give you a very brief background to situate the TAMI project. I'm not going to go into detail, but overall, just to say that despite some progress in reducing undernutrition, Ethiopia still has one of the highest prevalence of undernutrition among women of reproductive age and children under 5. Which coincides with a rising prevalence of overweight obesity, particularly amongst women in urban areas. And in Addis Ababa, the prevalence of overweight obesity is close to 30%. Nevertheless, we see that programs and funding for intervention remain primarily undernutrition focused. Next, please. So given these nutrition challenges, the TAMI project assesses first the extent and causes of the DBM problem, and then develop a roadmap for action to tackle it by characterizing current policies, program, the people involved in the double burden of malnutrition, and intervention priorities. And you can see here that really the framework used for the fellowship, which is the 4P cycle, is built around the problem, the policies and program, the priority, the people, sorry, and the priorities. TAMI draws on insights from several disciplines, epidemiology, nutrition, public health, policy science, and integrates also several methodological approaches that I'm going to briefly describe in this presentation. So the policy component, which is what you see in red, includes 3 sub-work packages. The first one is a systematic review of the shared drivers of the double burden of malnutrition in LMIC, with the aim to really propose and develop a framework of shared drivers of the double burden of malnutrition. This is really needed to adopt an integrated approach to the double burden of malnutrition. So this work is currently ongoing. The protocol has been published on Prospero. And briefly, just to say that of the 21,000 records that were screened, we included 65 relevant papers, 64 cross-sectional studies, and 1 RCT. Most of the evidence comes from Southeast, East Asia, and Pacific, and then followed by Sub-Saharan Africa and Latin America. We had about 9 studies that focused on multiple countries. With regards to the outcome, about 2/3 of the paper assessed the double burden of malnutrition at household or diet level, with a form of undernutrition in the child and a form of overweight obesity in the mothers. And 1/3 of the paper focused on individual level double burden of malnutrition, either in women or children under 5. The second and third sub-work packages that are listed really aim to understand both qualitatively through a photo voice study and quantitatively through a large secondary data analysis, the shared drivers of the double burden of malnutrition in Ethiopia, with a big emphasis really on understanding the role of diets in influencing the double burden of malnutrition. Next slide, please. The second work package aims to conduct a qualitative policy mapping review to synthesize the evidence on nutrition-relevant policies and programs that address different forms of malnutrition in Ethiopia. And I'm now going to present some very preliminary findings on this particular work package. Next, please. So first, I would like to share the matrix that we really used and developed to extract the data and synthesize the data. So some of you may be familiar with the Informers methodology. And so what we've tried to do here is develop like a double duty policy tool. And by double duty, I always refer to those actions who can simultaneously tackle multiple forms of malnutrition. And so for this, evidence was collated around, first in green, as you can see, the 10 double duty action that were proposed in the most recent Lancet series on the double burden of malnutrition. And also, we also extracted information around the enabling environment, which you see in blue, also known as the infrastructure domain. And overall, we had 46 good practice indicators for the WGT action and 20 good practice indicators for the enabling environment. And the selection of these indicators involves synthesizing evidence from major reports and academic publication on recommended intervention to tackle different forms of malnutrition. So this list may not be exhaustive and perfect, but it is an attempt to try and create that WGT policy tool to really understand the policy landscape. Next slide, please. So this is like just one example for two WGT action. So on the left-hand side, you have the name of the WGT action. So DDA7 is the school feeding WGT action. And on the right-hand side, you have then those good practice indicators that we developed, for example, for the school feeding WGT action. And so on the left-hand side in green, so we use the traffic light system, you can see those actions or good practice indicator for which we found a higher level of evidence across the documents. In orange are those for which we find some level of evidence, and in red are those for which we did not find either any evidence or a lower level of evidence. So here you can see that, for example, we found no evidence around price manipulation to make unhealthy food more expensive in school or menu labeling in school with nudges for healthy options. And there was also lower level of evidence for the promotion and sale of unhealthy food in and around the schools, and also free subsidized fruits and vegetables in school. So this is, I mean, the scale needs to think a bit more about it in terms of, higher, lower, and some level of evidence. But this is, as I said, very preliminary. Overall, we included 69 documents, either policies, program, guidelines, legal documents. And what we see in Ethiopia is that there is a good policy activity across all the 10 WGT action and good practice indicators. So we have a good breadth of the evidence or policy intention. Another thing is that those indicators that you see here circled are those that we believe are double duty. And so either they're natural double duty or they are indicators that can be made more double duty by tweaking them slightly. So for example, nutrition education in schools often, or any type of nutrition counseling focuses on dietary diversity to prevent micronutrient deficiency, undernutrition. And so by tweaking them slightly and incorporating more WGT messages, for example, by including messages around the consumption of unhealthy food and sugar sweetened beverages, we can make those actions slightly more WGT. Next slide, please. For the infrastructure support, we for now only use secondary sources, so either websites or academic publications to try and populate the different domains like leadership, governance, monitoring, and evaluation. So we can see that there are some good things happening around leadership and governance in Ethiopia, and you may think that there's less good things around funding and monitoring evaluation. But I want to say that here, the red so far, is going to be completed by consultative meetings with stakeholders, and the idea is to really complete the information around those domains by talking with the stakeholders, because I believe that those indicators here that may be in red may not be red. It may just be red because we didn't find or locate the evidence rather than it's not being any evidence. Next slide, please. So moving on to the third work package of TAMI. So as I said, it's about focusing on the people. And so for this, I will use the NetMap method through multi-stakeholder consultative focus group discussion to really map out the stakeholders and institutions that have a role to play in the double burden of malnutrition, with the aim to really identify potential candidates to promote those WGT actions. Next slide. And finally, the work package 4 is around the prioritization of action. And for this, we will use the multi-criteria mapping methods through in-depth interviews. So this is very much a mixed method with both qualitative and quantitative information. So we will gather scores around the prioritization, and we will ask stakeholders to gauge the different priorities based on different indicators such as cost, effectiveness, etc. And we will also have the qualitative information on the rationale and why they've scored those actions like they did. And finally, really, the idea is to bring all of these different work packages findings together and have a final deliberative workshop in which we would identify 5 double duty action that could be modified or implemented in the Ethiopian context, and facilitators for implementation will also be discussed with stakeholders. Thank you very much.
Thanks so much, Rebecca. That was a very interesting and insightful presentation. I think it's a very smart way of merging ways of looking at policy indicators and research methodologies. How they are merged is certainly subject for more discussion. The next presenter would be Paul Curie from the ICLEI network, who's going to be talking about AfriFood links.
So my name is Paul. I am the head of the Urban Systems Unit at ICLEI Africa. ICLEI is a membership organization of local and subnational governments around the world committed to sustainable development. And we feel very privileged to be the coordinators of the AfriFood Links project, which is run by 28 partners in Africa and Europe, and aims to investigate urban food systems and effectively change the narrative around urban food systems and support local governments to understand their role in driving food system transformation, but also to profile the work that they're already doing in their contexts. So, as with many EU funded programs, we have a rather ambitious frame to improve food and nutrition security while delivering positive outcomes for climate and the environment and building socio-ecological resilience in 65 plus cities. These are 15 African cities and 5 European cities. And then there's a whole set of network cities in ICLEI's network, IVOS, Ricolto, the Milan Urban Food Policy Pact, will share in their ideas around this work. And this methodology of city-to-city learning, we feel, is really valuable because it creates a space for people to build solidarity around shared work, but also to understand that different cities are experiencing very similar challenges and to showcase the various different approaches that they're all taking. I'm really excited by this project because it has a whole implementation process. It's got grounded research and action research embedded in how we're doing the implementation. It's supporting urban food governance and multi-level governance processes. It's supporting entrepreneurs to understand how they can contribute to improving food environments. It's got some tangible physical implementation projects, and then it's got a whole advocacy program as well. So the cities that are the project cities are shown here. There are 5 hub cities: Kisumu, Mbale, Cape Town, Ouagadougou, and Tunis in Africa, where there is quite a lot of deep research and engagement work, and then 15 sharing cities who support by adding their engagement in. We've been through the project preparation stage and have started to do initial research and initial stakeholder mobilization. So in this, I don't necessarily want to share the outcomes of this, but I will be excited for FERN next year and even more excited for the one after that, where we'll have really tangible examples of what we're engaging. But to share the conceptual theory of change that was developed as part of the process, what became very strong in our arguments about urban food systems is that there's a whole need to shift the narrative away from agricultural intensification and urban agriculture towards building understanding of urban food environments. And here, in very simple terms, and I'm sure everyone has their own fabulous conceptions of the food environment in this room, we're framing it effectively as where people make their food choices. And we argue that infrastructure investment, business innovation, and then a keen awareness of cultural preference, are the elements that we want to focus on in terms of improving the food environment. And these, of course, are all situated within broad governance processes with various vested interests that we have to manage, engage, negotiate with. And if we do our work right, we'll have positive outcomes on food, nutrition, security, health and well-being, and environmental impact. Understanding, of course, that we're dealing in a space where there are various exogenous impacts of climate change, regional trade regulations, and global health and economic shocks. So that's our framing. I think it's very rich for me to not be the only one presenting this project, but to share the voices of some of the cities who are articulating their various challenges. So I'll share the first video, which doesn't have any of the fabulous partners in, but has the cities sharing why food systems are important to them. So I hope this comes through.
Urban food systems need all transformation.
Les systèmes alimentaires urbains ont besoin
d'une transformation
audacieuse. We don't have enough food when it comes to production, but then the little that we produce, there is wastage.
Our biggest challenge now is climate change. Waste, how to manage and how to reduce waste. From farmers, from transporters, vendors, but also from consumers.
Renforcer tout ce qui est chaîne alimentaire et améliorer la fourniture de ces aliments auprès des ménages et des marchés reste le plus gros challenge.
parmi lesquels des foires qui s'organisent chaque année par des structures organisées, notamment les Sahel, qui est une foire nationale, maintenant même internationale.
This is actually an opportunity for organizations that are in the food security space to actually leverage on this provision that is there in order to tackle issues that are related to the food systems and food security.
We have a good working food strategy, a sustainable food strategy, and an active platform, a multi-stakeholder platform of local partners who are putting sustainable food in the center.
So we always need to keep in mind that we work within a food environment, and that means that all our interventions need to consider the social, political and cultural point of view.
Is fragmented.
It's unique. Projet de microjardinage.
It's complicated, colorful.
Niamey est une ville au cœur du Sahel avec tous les défis liés au changement climatique.
It's work in progress.
La chose qui me passionne dans le projet AfriFood Links, c'est l'apprentissage à travers les expériences d'autres villes. En tant que fonctionnaire de la ville de Ouagadougou, il est important pour nous de ne pas travailler en vase clos, mais de s'ouvrir aux expériences d'autres villes pour mieux apprendre de leur réussite afin de pouvoir approfondir ce que nous faisons au niveau de la ville de Ouagadougou.
So it's promoting sustainable production of food around the riverbanks.
C'est qu'AfriFood Links s'est pu fédérer autant de personnes et de villes autour d'un même objectif, à savoir assurer la sécurité alimentaire de toutes les populations. Et à partir de là, à partir de nos échanges, qui soient donc des expériences des uns et des autres, qu'elles soient positives ou négatives, on peut apprendre et établir un système de gouvernance qui soit approprié à chaque ville.
It's a platform that brings together different sizes of cities both from the developed world and the developing world. So we are able to learn from each other. More importantly is the opportunity for capacity building.
And it's coming to answer a real need for change in the way we tackle not only food system but also the issues about climate change.
It's not only talking about food itself, talking about the whole food system.
So to share just a few things that we can invite this group into. Firstly, we are really excited by the ideas of bringing art and culture into how we talk about food environments. how are people engaging with their markets, with the food they eat, with the food they cook, with value chains. And so this year we ran a photo competition for people to share recipes. And here are a few of the winners, and I'll share the link as well. What we're hoping to do with these crowdsourced recipes and images is to develop a recipe book that then also connects to how we could potentially improve the resource efficiency, the safety, nutritional quality of these foods, or promote them as already being so. There are a lot of creative elements in the project. Another link that I will share is a call to youth ambassadors. We've brought 5 on already for the hub cities, but we're seeking a further 10 young people to be interlocutors, to share stories from their communities, from elders, from other youth, about their experience of urban food systems. So I invite you to share that with your networks as well. And then finally, as part of the AfriFood Links website is a knowledge hub, which we are aiming to populate with not just the resources of the project, but resources about urban food systems and urban food environments. So we invite you to add to this. It's just now launched, so it'll be getting more and more inputs. And this is not to replace databases, which are incredibly rich in resources, but to really create a space where anyone landing who's interested in urban food systems has a first, and particularly with a focus on Africa, but of course open to many resources around the world, can have a really quick inception into what the narratives are about, how they can understand their food systems, what research already exists, and what they can contribute. So I invite you to head to the website. I'll share some links into the chat, and to share resources, to share these ideas, to subscribe to updates, and to email us if you have comments, critique, ideas, or opportunities for collaboration. So thanks very much for the invite, and look forward to the discussion.
Thanks so much, Paul. That was really interesting. And I can only start to imagine what it must have taken to put a logic model for a project this size together in terms of outcomes, etc. So once again, thank you so much. I think we can go on with the next speaker, Fiorella Piccioni. Yes, please, the floor is yours.
Fantastic. I will just share my screen. Okay. Okay, perfect. So I guess I'll just crack on. I don't think Paul has managed to join, so I'll do, we had decided to do half and half together, but I will just present everything myself. So good afternoon, everyone. My name is Fiorella Piccioni from the Natural Resources Institute of the University of Greenwich. And I'm very delighted here to be part of the Food Environment Research Network today to present our new project entitled Political Economy Analysis of Food Industry, or P5, unpacking the influence of the food industry on adolescent consumption of ultra-processed foods in Ghana. So we all here agree that our food systems are making us unhealthy. For example, ultra-processed foods are dominating increasingly our diets. And although they're delicious, their consumption is linked to rising obesity, cancer, type 2 diabetes, and other non-communicable diseases. In Ghana, for example, the trend and the prevalences of overweight and obesity are extremely alarming, especially among adolescents, between whom the consumption of snacks and the carbonated drinks are increasing. In particular, in Ghana, also the economic trends of ultra-processed food sales are incredibly high, and the forecasts are looking at Ghana at one of the countries in the world where the forecast of the purchase of this type of products is one of the highest in the world. But this is not a local issue. This is a global issue and a systemic issue, because in a way we know that our part of our food system, not all of it, but part of our food system puts profit in front of health, nutrition, the biodiversity degradation, and other important issues that are not currently taken into consideration. So we believe that for a global systemic issue, we need a systemic approach, and we proposed a political economy approach. And our project develops the political economy analysis of the food industry toolkit, or P5. So for those who are not familiar, what is a political economy of food? And we have used in our project this particular notion and definition of it. So understanding consumption requires looking at the system by which goods and services are provided, not just how they are produced, but the historically involved structures, power relations, and cultures within which they are located. And throughout all the levels of our analysis, so we analyze aspects from the micro level to the meso level and the micro level. So at all these levels of analysis, our project engages with the four typical political economy questions: who owns what, who gets what, who does what, and what do they do with it. So this particular framework epitomizes our conceptual framework for the project, the political economy analysis of food industry. And the aim of the project is to link the different levels of understanding of the consumption of ultra-processed foods. So I'll go in order. First of all, our main aim is to contribute to an effective policy and regulation design and the implementation of policies that reduce consumption of ultra-processed food in sub-Saharan Africa. Our overarching objective is to improve an understanding of political economy of ultra-processed food processes and rules that influence consumption among adolescents in Ghana. And to do so, we have devised an integrated multi-scalar approach where we look at different aspects of the influences of the food industry on consumption of adolescents in Ghana by looking at the micro level, so the local formal and informal environments where children, schoolgoers interact with the ultra-processed food. The meso level, which are the markets, well, the spaces where the food travels between the production to the consumption, and importantly, the informal and informal interaction between them. And finally, the macro level, so the policies and the legislation environment that stipulate how ultra-processed food is transferred from production to consumption. So our project is located in 3 areas of Ghana, and roughly each of the work packages will take place in each of these locations, although of course there is a lot of cross-pollination and traveling between these areas. So we will start our work package 1 with at the micro level, so looking at the socioeconomic drivers of ultra-processed food between adolescents in Tamale and in the peri-urban and rural area of Nyankpala. Then we will kind of follow our ultra-processed foods to Kumasi, where we will focus our work in the Kejeita market, one of the most important hubs of manufactured goods that travel then to the northern parts of the country. And then we will focus our work package 3 in Accra, where we will engage with multiple actors from government and other stakeholders and the food industry to understand what are the processes through which they exercise power in order to influence or reduce the consumption of ultra-processed foods among adolescents in the country. So this is our team. We are an interdisciplinary group of social scientists. We have just only started the project. The project was funded and started just recently in August 2023. So we are very much at the very inceptional phase of our journey. And as Paul was mentioning, I'm very excited for next year FERN conference to share some of our results and some of our contribution to this conversation. We're very much we would love to hear very much from you and other colleagues that conduct project and policy in this field, to learn from your experiences. And yeah, feel free to contact me or any other of my colleagues to learn more about our initiative. Thank you very much for the space.
Thank you so much, Fiorella. Indeed, very, very interesting. Taking a political economy lens for looking at the food system, it's quite ambitious. I'm very much looking forward to what's going to come out of this project as well, and I have no doubts that there will be quite some questions also. The next speaker is someone from colleague from Ghana, Gideon Amevinia. The floor is yours.
So good afternoon to everyone, and first of all, I would like to thank the organizers of this event for inviting us, the Healthier Diet for Healthy Life project team, to present our work. My name is Gideon Amevinia, and I'll be doing this presentation on behalf of the project team. Oh, my slide is not moving. Okay, so before I talk about the Healthier Diet for Healthy Life project, I would just want to just mention that 3 related projects that's the HD4HR project benefited significantly from, or I would like to say effort from this project led to the birth of the HD4HR project. So they are the Dietary Transition in Ghanaian City project, code name DFC project, also the Dietary Transition in African City projects, and then last but not the least, Meals for NCD Prevention project. Now, by way of background, Ghana, just like other African countries, is experiencing a rise in the prevalence of obesity and nutrition-related NCDs, and this is high among urban dwellers and mostly among women. A comprehensive assessment that was done a couple of years ago of African countries, including Ghana, by the Institute of Health Metrics and Evaluation at the University of Washington, noted that Ghana has recorded more than 500% increase in adult obesity prevalence over a 30-year period. Also, currently, over 40% of adult deaths in Ghana currently are attributable to NCDs. So this surge in NCDs and its associated mortality is observed to be partly as a failure in our food environment to promote healthy foods or diet. So there has been calls placed by leading health organizations like the World Health Organization for government to take actions and also put in interventions that can transfer the food environment to promote healthier diet. So in Ghana, from several engagements and meetings as part of the projects I mentioned earlier, the DFC project and the Meals for NCD project, stakeholders, including government and non-government actors, have called for food-related policy interventions to address diet-related NCDs. Not just that, but also the long-standing challenge of undernutrition and micronutrient deficiency. So one of such engagements was part of the Ghana food AP exercise. I think Prof. Lam mentioned this during his plenary presentation. And this exercise assessed the extent to which the Ghanaian government implemented recommendation policies to improve the Ghanaian food environment. Also, as part of that exercise, stakeholders also identified gaps, but also identified solutions to address the double burden of malnutrition through policy interventions that improve our food environment. So this paper published by Lighter in 2022 as an output from one of these meetings, which is the food AP exercise, captured 4 top priorities, policies that the Ghanaian stakeholders will want to see the government of Ghana implement to improve the food environment. So the government of Ghana should, they recommended, come up with legislations that can control the marketing of unhealthy foods and beverages in the media and also in and around our schools. There should be policies that can ensure healthy foods are affordable again, that the government should provide support relating to food labeling, as well as policies that support or improve public food procurement with particular emphasis on the school feeding program. So the government of Ghana has shown interest and has paid heed to these suggestions, and therefore this led to the HD4HL project. So about the HD4HL project, the actual project title is Developing Evidence and Action Towards a Double Duty Food-Based Policy Bundle to Assure Healthier Diets in Ghana. So I heard Rebecca explain what double duty means. So by double duty food-based policy bundle, we are referring to a group of policies that have the potential to simultaneously reduce the risk or burden of both undernutrition and overweight, as well as other diet-related non-communicable disease. So from this project title, we could the project Healthier Diet for Healthier Lives, therefore HD4HL project for short. Regarding the implementation of the project, this project is being co-implemented by a coalition of government agencies, including the Ministry of Health, the Ghana National Development Planning Commission, and the Food and Drug Authority. Also, academia led by the University of Ghana, and also a coalition of actors for public health advocacy, a group of civil societies coming together. With regards to financial support, this project is receiving financial support from the International Development Research Center, that is IDRC Canada, together with the Rockefeller Foundation. So now to the overall objective of the project is to build evidence and mobilize multi-stakeholder actions towards a policy bundle for healthier and more equitable consumer food environment. And this is to reduce the double burden of malnutrition. Regarding the specifics, the project aims to, first of all, develop and validate a fit for local purpose nutrient profiling model. So basically, nutrients profile model classifies or rank food according to their nutritional composition. So once the nutrient profiling model is developed, the interest is to then use it to develop a set of food policies. And currently, under the HD4HL project, the government of Ghana is considering developing the food marketing restriction policy, which concerns itself with regulating marketing of food and beverages in order to reduce exposure to unhealthy food and also protect especially children from the harmful impacts of unhealthy food marketing. Again, the second policy is the front of pack food labeling policy, and this will aim to enable or help consumers to select healthier food products and also provide them with a better understanding of what is in the food that they eat. The third policy being developed under this project is the food-related fiscal policy, which will aim to promote healthier diets by imposing tax on unhealthy food options to increase their prices and therefore decrease their purchase and consumption, as well as introduction of subsidies on healthy food to encourage their consumption. The last but not least is public food procurement and service policies. So again, this policy, when will require government settings like schools, hospitals, set criteria for food served or food sold within these public settings, so that governments will therefore use public funds to purchase food that are healthy. So these are the four food policies that the government of Ghana, through the Ministry of Health and its partners, are developing under the HD4H project. So against this background, we generated this framework, which began with the development of the nutrient profiling model. And once it is developed, it will be used to underpin the development of the implementation of the food-based policies I mentioned earlier. And once these policies are developed, our hypothesis is that it will lead to an improved food environment, and an improved food environment will then lead to increased consumption of healthy food, also reducing the consumption of unhealthy food, which would then lead to improving health and nutrition, and therefore a healthier life. So this is the framework or the logic model we are using for this project. So on the work package, we have 4 work packages, and the first work package is focused on generating evidence. So evidence that to be used in the implementation of the activities of the project. So this work package includes the conduct of rapid reviews. We also have some desk reviews and various policy analysis. At a point, I'll be showing some of the reviews that we are doing. The second work package is focused on compiling an up-to-date food composition data. So for food products found in the Ghanaian food outlets, and then that will then be used in the development of the nutrient profiling model. As I noted earlier, once the nutrient profiling model is developed, it will then be used to underpin the development of the 4 policies. So that's then leads us to work package 3, which is the main focus is to develop the food-based policies, the food policies. From the beginning of the project to the end, we have civil society and academics contributing through advocacy and scholar activism. So this will include sensitizing the public about the value of having a food-based policy bundle, and also advocating to decision makers to develop equitable and gender-fair food-based policies. So with the next few slides, I'll try to give a very high-level summary of what we've been up to that far. So this Healthier Diet for Healthier Life project was launched last year, and we were fortunate to have our Minister of Health to conduct the launch of this project. And the project has currently developed a couple of guiding documenting frameworks, also terms of reference document to guide the implementation of this project. Again, various project committees have also been constituted. So we have what we call the project multi-stakeholder technical task team, and this group is basically providing technical guidance to the way these policies, the 4 policies, will be developed. Also, the project advisory committee providing overall oversight to how the project is conducted. So specifically on work package 1, which is focused on the evidence synthesis, this is led by the University of Ghana together with other co-opted consultants. So these are some of the reviews being conducted. So let me just pick maybe 1 or 2. So for each of the policies under development, we have a specific review looking at the implementation of, for example, front of pack labeling in other lower middle income countries. So from this review, the aim is to have recommendations, get to learn best practices and challenges that these other countries within the lower middle income countries face, so that can be used to inform our policy process. So we have same for that for the marketing restriction policy, also for public food procurement policy, and the food labeling too. So most of these reviews are almost in completion. So at the right time, we'll have all of them published and also display on the project websites. With regards to work package, this is 2. This work package is led by one of the government institutions, so talking about the Food and Drug Authority, and supported by the University of Ghana. So it is heavy on the food composition data compilation and then the actual development of the nutrient profiling model. So so far, we also have a subcommittee or a technical working group formed, and they have been providing guidance as to how the nutrient profiling model that will be developed under this project will go. Currently, regarding the food composition data compilation, we have a team of food data collectors on the field, and so far they've been able to take pictures of about 11,000 unique prepackaged food products. And for this 11,000 products, data as in the nutrition information data displayed on these products have been so far harvested from 6,000 of them, and it has been formatted and currently being used to inform the nutrient profiling model for Ghana. So again, that leads us to the nutrient profiling model development, and this is currently ongoing. The project is in partnership with the Food Compass team. That's a team at the Taft University, and they are supporting the project to come up with the nutrient profiling model. On the main work package, so work package 3, which is the development of the food-based policy bundle. Again, 2 government institutions in Ghana. So in Ghana, we have the Ministry of Health in charge of having the mandate to develop policies. So they are leading the development of the 4 policies, and also supported by the National Development Planning Commission. So for each of the policies and the development, we again have subcommittees that meet monthly and provide guidance as to the scope of the policy and other details that the policy should detail. So currently, the policy drafting is ongoing, and the expectation is that the first draft of these policies, that's the 4 policies, should be ready by end of this year. So on the
Gideon, sorry to interrupt, but can you try to wrap up? We already.
Yeah, so this is my last slide actually.
Okay,
so
thanks.
on the work package for which has to do with the advocacy. So we have a coalition of civil societies formed, and these civil societies have been conducting sensitization for the public, and also engaging decision makers to develop not just policies, but policies that are equitable and gender fair. So this is what the HD4HR project is about, and this is the project website, and as well as the project email. So yeah, thank you.
Thank you so much, Gideon. That was a very concise overview of a very comprehensive project. I keep being amazed by the amount of research that is being done by the different partners. It seems our last speaker is not present, Prof. Agyemang from the Vrije Universiteit Amsterdam. So if not, we can open the floor for discussion.